There is a playlist on career, and some of the videos there reflect on medicine as a career, uh, why pediatrics can be a career choice, why neonatology can be a career choice. And in terms of choice of place to work in, we have United Arab Emirates and the UK, which are the places I worked in away from India. So just to give you an overview, I trained in India in Stanley Medical College in Chennai, and then I did my MD Pediatrics from Jipmer in Pondicherry, which is a tertiary institute. I then went to Postgraduate Institute of Medical Education at Chandigarh, where I did my DM in neonatology. So both MD Pediatrics and DM Neonatology are 3-year courses, and DM is a super specialization. I went to UK and partly did the training there in Cambridge. I then worked as a consultant at Visha General Hospital in Glasgow, and then I moved to UAE. So I've been in UAE since 2012, and I've been a consultant neonatologist. I'm the head of department at the Nath Al Emirat Hospital in Abu Dhabi. When I say I'm going to give you some advice on working in UAE, it doesn't mean I can help you with jobs. Obviously, I'll guide you on how to apply, but searching for jobs is beyond the purview of an individual, so you have to select the hospital you would like to work in and then apply for their individual teams, and there will be an interview process. It would help if you have the license already. Some of you may be nurses who are interested in working in UAE, and obviously you have individual family reasons for why you want to move, but the most common reason people move is because they want a bigger income, they want more controlled working hours, and they want stability. United Arab Emirates is a conglomeration of 7 emirates. So the capital is Abu Dhabi, and we have Dubai. We have the other emirates: Sharjah, Ajman, Fujairah, Al Quwain, Ras Al Khaimah. So Al Ain city is part of Abu Dhabi Emirate. You might review job options in Al Ain, and that's a city next to Abu Dhabi as well. In terms of working, obviously the UAE mainly caters to local and expat population. Most of the work here is insurance driven. You have government sector and you have the private sector. In 2000 or so, most of the work used to be done in the government sector, but the government made a directive that by 2010 majority of the work should go to the private sector, and that's actually happened successfully. The private sector has grown in leaps and bounds, and the care provided in the private hospitals has a reasonable level of standard, because the JCI Joint Commission Hospital accreditation is almost compulsory in most of the emirates here, and because they follow a certain standard in HR, in selection of people, the licensing process is fairly strict. You also need continuing professional education on a regular basis. So all of this makes sure that there is a reasonable standard. Of course, the level of standard will vary from hospital to hospital. The bill will vary from hospital to hospital. The salary might vary to a certain degree. The scheme of salaries, whether it's a package including your accommodation and flights and things, or you just get a monthly salary and you pay the rest of your requirements, varies from hospital to hospital. But majority of them pay for your licensing, pay for your visa, and they pay for your travel to and fro from the country. So the salary grades here are fairly fixed depending on which license you hold. So we have 3 main categories of licensing. The previous licensing category of training and under supervision is no longer there. So you can be a general practitioner. So this would apply to those who have completed MBBS with a certain level of experience, or those who have done pediatrics, for example, either DCH or DNB or MD Pediatrics in the first 3 years. If you don't have an MD Pediatrics or a diploma in National Board, you will not be able to progress to a specialist license in pediatrics. In most other countries as well, you have equivalent qualifications, and according to the country you train in, there is a requirement for a time frame from your completing the qualification to getting a specialist license. Of course, if you have a CCT from UK, for example, you don't need any time frame. If you have trained in the UAE, you're a UAE national, you don't need the specific time frame. So once you get your license, you have to work in that particular specialty to gain your period of experience. If you already have MD Pediatrics, for example, and you have a 3-year experience from India, you can directly apply for a specialist license. The same applies to the Diploma at National Board or DNB. And once you apply for that, you can appear for an exam. The exam is based in pediatrics and in general medical concepts, and it's not very tough, so most of them come through it, but you need some basic preparation to go take the exam, and you're allowed to take the exam again, I think up to 3 times if you don't clear. Many people ask the question whether you should apply for the license first or they should move here and then try to apply for the license. So if you have the license in hand, your opportunity for jobs will increase. So the person who is looking for someone to quickly join them knows that this person already has taken the exam, has a license, and so you won't get the license to hand, but you get a letter from the DHA or the HAD which confirms your eligibility for the license. So once you have this, your ability to get into a job will increase. The people who have DM neonatology or DM or MCH will be able to apply for consultant license after 5 years of having the qualification. This doesn't guarantee that you would get the consultant license because it needs an interview process, but they can work as a specialist during that time in that field. So a specialist neonatologist essentially can manage neonatology under his care, and whether the hospital requires a consultant or a specialist depends on their requirements. If already a consultant pediatrician is there to meet the requirements of the Department of Health, for example, for that unit, the other team members can be specialist neonatologists to run the show, and you can be on a consultant license if you have it. I mean, you can be on the consultant rota if the team decides. So your work pattern may not differ, but the salary will differ if you are a consultant or a specialist. And obviously, career progression wise, if you have DM or MCH, you can progress to consultant license provided you clear the consultant interview after 5 years at least. The longer you have, the more chances you have, and usually the interview as well, you have 3 chances to clear it. This is about the licensing process. So there is something called the PQR, Professional Qualification Requirements, and this is the document. This is from the HAD website, and you may also have the actual criteria according to the country. For example, in India you have the tier 1 and tier 2. So the tier 1 is no qualification from India will give you a tier 1, while a CCT in UK, for example, will give you a tier 1, and the Doctorate of Medicine and MCH can give you a consultant license, which is tier 2, and the tier 3 will be the specialist pediatrics license, so the DNB, MD and Master of Surgery or MS. The specialization certificate from Iran. These are different countries, and if you scroll through that, if you are from a different country, you can see the exact requirements. You can easily get this document on my earlier video, which is discussing the career, and I can also, the Department of Health, you can just Google HAD PQR, HAAD space PQR for professional qualification requirements, and you'll be able to get that document. In terms of medico-legal issues, previously when I moved, people used to scare me that the medico-legal environment is very scary, but in the past few years they have made it friendly to the doctors in making sure that they cannot arrest you in a criminal case based on medico-legal. The same applies to India as well, for example, now. But the environment, work environment, the cultural environment, the patients, they're all nice. You wouldn't find it any different, but you need to keep updating yourself. You need to practice to the high standards of ethics, and good communication skills, good documentation skills are very important as well. You do have lots of opportunities for professional furthering your knowledge, for example, like conferences, but there is not much scope for research. So if you are an academic person and you want to go into research, I think a fellowship in US, Canada or UK or even Australia would be a better choice than moving here. Most of the people who move here make it as a career move, The government here is very friendly to the doctors, and they made it one of the eligibility criteria for the 10-year golden visa, which is very interesting opportunity, and we can stay here, we can invest here without any hesitation because you have this opportunity. So this is to give you an overview, and there are many questions about fellowships, and fellowships in IAP or NNF do not give you any specific advantage here, though the experience may add to it. So it doesn't add to the licensing. So if you have an MD, you can get a specialist license after 3 years experience. If you have a DNB, you can get a specialist license after 3 years experience. But if you have DCH, you'll be working only as a GP. You can still work in neonatology or pediatrics as a GP, but you'll be mainly catering to the inpatient population or the emergency based cover of urgent care, not the clinics of your own for pediatrics. The DM and DNB, the recent DNB super specialization, I don't see it on the PQR, and only in Dubai they are starting to give consultant license for specializations based on experience in a field, though it's variable, and once you work here for some time you're more likely to get than when you come directly. So that DM neonatology is likely to get you the, or DM in any specialty may get you the consultant license more guaranteed than DNB, and probably they will revise it because the DNB super specialization is not that established. The fellowships, as I said, you can't be sure that it will add merit. Maybe the employer may consider that as an experience, and you may stand a better chance than a candidate who is not experienced, but your license will be similar. So let's see if you have any questions. You can please mention it in the chat box. So I'll wait a minute or so if there are any questions. If no questions, I'll stop the session.